DIC. On the air with us now is Dr. Mark Horne, past president, Mississippi State Medical Association. By the way, we're on Channel 70 on C-Spire and also anywhere at supertalk.fm/watch. Just a couple of the places that we are. Good morning, Dr. Horne. How are you? Good to see you, sir.
I'm glad to be here.
Many things to talk about. And first of all, I was looking at the weekend numbers, and the 5,048. We had 54 deaths. A total of 32 deaths occurred between August the 8th and last Thursday, August the 19th. So what's your review of this morning after the weekend? Does it look like it's subsiding at all? Are we getting a hold on the number of people that are getting their vaccinations? What's your Monday morning analysis of this?
I wish I could say that things were looking really good, but I don't believe they are. As we look at the numbers, when you look at like a weekend, those numbers, we always look back at least 7 to 10 days. And Dr. Byers always reminds me to look at what's called the epi curve. And our epi curve is still on a ballistic angle. And so we're still going up. In my hospital here in Laurel, we went up over the weekend, more cases, more sick people, young people in their from high teens to 30s and 40s and 50s on ventilators. So, no, I wish I could say it was better, but it's really not.
Let me ask you this, because we had the story last week about how many unused beds we had in the state. Does that mirror your hospital in Laurel, that you have some beds that are unoccupied simply because you don't have the personnel?
Absolutely. We could put more people in the hospital bed space-wise, not in our ICU. Now, you got to remember, our ICU, we have a 13-bed ICU, and I haven't seen today's numbers, but over the weekend we were at 20. We have rooms in the ICU with 2 patients per room, holding patients in our ER, and opening kind of a step-down ER, which we've never done to hold patients we would always have had in the ICU previously. So, yeah, I mean, we've got room for not-so-sick people. Yeah. But for the really sick people that we're seeing, we don't have room, and we have terrible staffing problems, just like everybody.
What's the status of the feds sending their people here?
Well, in Laurel, I don't think we're going to get anybody here. I've heard rumors that there may be something headed to the coast and to Hattiesburg. I know that Jackson has some, and I've heard on a call this past week that there were some resources in Tupelo. It couldn't come fast enough. Hospitals across the state are right at the breaking point. I mean, when you have to set up emergency hospitals in parking garages, things are bad.
Yeah. I just want to kind of clarify this a little bit. And again, Dr. Mark Horne is, I guess, past president, Mississippi Medical Association. Is it mostly nurses and not doctors, or do we also have a shortage of doctors?
There are certain types of physicians we could use more of. We've got one pulmonologist in Laurel that's working 7 days a week has for over a month. For the most part, we have adequate physicians. For the most part, we have adequate what we call licensed providers, people who can write orders, NPs. We're terribly short of registered nurses, licensed practical nurses, respiratory therapists, and all of the support staff that is necessary. We've got enough officers. What we need is more enlisted. We need the people who do all the heavy lifting of caring for these very sick patients. And anybody who's been in the military understands that everybody is important to the team. Yeah. And nobody is insignificant.
I do want to ask this, though. Is this shortage has been here for a while, even before the pandemic itself, as far as nurses are concerned? Is that a true statement?
It's been a challenge. We've never had an excess of nurses in Laurel, but we had more than enough to take care of our day-to-day needs. I mean, a little bit of extra, but now this pushes things to a level. I mean, our nurses are tired and burned, and they're burning out. Yeah.
Is there a combination of reasons for that? And I think and I'm not sure in what order they go. Is it because the nurses don't want to get some nurses don't want to get a vaccination, or because they're burned out taking maybe other positions as travel nurses, et cetera, or that they are home and they've decided to just not do this, and the stimulus money has kept them at home? Or is it a combination of all those things?
I haven't heard anything about stimulus money, because nurses make enough typically that they're not going to make as much on stimulus payments at home as some of our staff that gets paid less. I think what it is a variety of things. As you said, number one, travel nursing has taken some people away, but that's temporary. The other thing is, it's really hard to pull a 12-hour shift 3, 5, 6, 7 days in a row, taking care of incredibly sick people, much sicker than normal, at higher numbers than you're accustomed to, and then watching people die, watching young people die. It really, we do this, and we've all seen it, but we don't usually see it this intensely, over this extended period of time. Yeah. You got to remember, we've been doing this for over a year and a half.
Yeah. The Speaker of the House, Philip Gunn, said something, I think, last week. He said that he would like, at least for the governor, to consider calling a special session to maybe put some monetary enhancements in there. Is that something backed by the Medical Association?
I don't know that we have official policy on that from the Medical Association. I will tell you, from my standpoint as the Chief Medical Officer of South Central, and listening to other CMOs and CEOs of hospital systems around the state, yes, that would be extremely beneficial to help us keep and retain the nurses we have, so they don't go away to travel agencies. And it doesn't take away the strain, but it does let them know that you care. A little extra helps them know you care.
There are not really too many other options, are they?
You can't, people say, well, we'll just surge some beds. It's about surging staff, and you can't surge a person that takes 2 to 4 years to train. It doesn't work.
Yeah, I asked this question yesterday, and I got some information this morning on this one. Preliminary study shown that in the case of a breakthrough infection, the Delta variant is able to grow in the noses of vaccinated people in the same degree as if they were not vaccinated at all. Now, this is a story I found on the National Geographic article. The virus that grows is just as infectious as that in unvaccinated people, meaning vaccinated people can transmit the virus and infect others. These were some studies done in several locations. The next logical step was to determine whether vaccinated people could shed infectious virus, and apparently, according to this study, they can. Have you got any data on that at all?
I've read the same studies that you're quoting, and I've talked to Thomas Dobbs and Paul Byers extensively. Short answer, get vaccinated. I know this befuddles people. They say, well, if you can get vaccinated but still get infected, why get vaccinated? Because the vaccinated people don't end up in the ICUs anywhere nearly as much. The vaccinated people rarely get sick. This weekend, I worked our antibody clinic where we're giving Regeneron infusions. And I saw almost 30 people. The folks that I saw that were sick were unvaccinated. The people who were vaccinated had minimal illness, and they were getting Regeneron so that they would get well faster and wouldn't pass it on to others. This is the reason, however, what you just quoted, why even the vaccinated need to keep their mask handy if they're in public. As much as I love going to church, it's the reason I'm not going to church right now. I attended online services yesterday morning, because I don't want being around it all day, every day. I don't want to be the vector to someone else. And I would encourage everybody to just put their personal desires aside, take care of their personal needs. We all need some things. So take care of your needs, put your desires aside. Let's get this down to a point where we can keep it down.
Can you hang on for a second? I want to ask you a couple more questions.
Absolutely.
I got this from one of our friends, Dr. Easterling, and he texted me, said, just got a text from a patient. They heard about a patient that is in, I'm not sure what city. The class is quarantined. She has a 6-year-old in the class who tests positive. And apparently the 6-year-old may or may not have given it to the grandparent, and one of the grandparents happens to be in the hospital. This is how it's beginning to raise even more concerns with the younger population, and I want to talk to Dr. Horne about that. What's the concern as the Delta variant is attacking younger people, and also what's behind that if people decide not to get vaccinated? Maury's out there. Mississippi's only Level 1 trauma center and teaching hospital announced Friday of last week it will now mandate all employees and students to be vaccinated against COVID-19. The policy is a reversal from a rule put in place last month that allowed employees or students to skip the vaccine if they agree to wear an N95 mask while on campus. I think it is happening to just about every hospital, and it's more and more mandates coming up. Your thoughts on that, Dr. Horne? Mark Horne.
Nobody likes to mandate things, but if you're a construction worker and you go on a construction site, you wear a hard hat or they won't let you on the site. If you're working on an oil rig, my patients who do that have to wear fireproof clothing, whether they like it or not, if it's comfortable or not. Being vaccinated against a deadly disease, and even if you don't get terribly sick with it, you can spread it to others, like in our nursing homes, which we've seen. It's basic common sense. I don't like telling people they have to do certain things, but it really is not different than any of these other examples in my mind.
It is different in one way. In the hard hat, if somebody gets crushed in the head from a moving crane or something, the contagious factor is not there. Everybody else won't suffer the skull crushed. So in that, being a virus being contagious is even more of a reason for that mandate to happen. And I think we said it last week or week before last that government mandates is something that nobody wants to have. And it ought to be the mandates from the individuals, the hospitals, the schools, the businesses, that your options are this. You get it or you don't work. But you still have the option not to get it. But I don't understand how some of these the nursing homes, long-term care facilities still have a percentage of people working in those places that are not vaccinated.
It's a real challenge. I see some of those as patients, some of those people working in those locations who are not vaccinated. And I talk to them non-judgmentally. I ask them questions and why. And there's still a level of distrust. It varies from patient to patient, but a lot of it boils down to not trusting the pace at which the vaccines were instituted, not trusting the government's push.
Yeah.
I get it, but this is, I think you were absolutely correct. If it was only harming you, that's one level of, okay. But when you harm other people in the process, and that's what does happen, and it's become so political. Listen, I'm a physician. I'm not a politician, and I do medicine. And so I hate that politics has gotten involved in medicine. It doesn't mix well.
Yeah. I think, and we had a very active exchange all week long on Twitter last week. And some of the things we brought up, and some of the people who follow me on Twitter brought up some very, very good points. And one was a 2014 or 2017 article where we even covered it on the air, and I remember doing this, about the Russian bots that were out there, people who were employed full-time every single hour of the day. In one of the ones that they dropped some Twitter accounts, it was well over 2,000 people who were doing this. And their full-time job is to cause confusion as far as vaccinations. Both ways. It's not good for you or it is good for you, but the major thing that they were doing is to cause confusion and chaos in America. And that's a big part of it.
Stir the pot. Yeah, stir the pot. Listen, before we get out of here, I just in case, I want to give a real shout out to Jerry Weiland, who has replaced me as the president of the Mississippi State Medical Association. Yep. She's a pediatrician from Vicksburg, doing a great job. So, Jerry, looking forward to working with you. And
well, you're going to have to tell her she's got to come on the air, too, with us.
Absolutely.
Let me do this before I let you go. Are you concerned, and I know you are, but tell me the level of concern you have with this Delta variant moving closer and closer to younger and younger people, I should say.
It's tragic. We've personally seen, I know of two people in their mid-30s at our hospital who died and left behind spouses and young children. I know of a 13-year-old who died. My wife helped take care of the mother. And so it's just unnecessary and tragic, and it's heartbreaking.
Well, so much more to ask you, and we'll just do it next time because I wanted to know a little bit more about the Regeneron, or Regeneron?
Regeneron, or Regenco is the brand name, but Regeneron.
We'll get you back on.